Good evening, everyone, and thank you so much for taking out time to join us today. I know 5 p.m. on any day for a doctor becomes a little difficult, but we made our bets, and I just hope that the time that you have taken out really adds meaningful value and meets your expectations today. Let me begin by introducing myself. My name is Sankalp Gupta, and I'm serving as a director at Dr. Bilal Clinical Laboratory. It's a real pleasure to have all of you with us. Today marks beginning of our new initiative. We're calling it Partner in Practice. The idea is simple. While clinical excellence forms the core of your work, a modern medical practice is influenced by so many things: how patients perceive you, how they experience your touch points, how communication flows, and how you adapt to the rapidly evolving digital landscape. Partner in practice is our commitment to contribute to this larger ecosystem by bringing meaningful conversations with subject experts, just like we will have it today, on very different topics that can really empower you, that are clinicians, across different aspects of practice development and growth. Let's come to today. Our focus today is on topic that all clinicians encounter and may often find it confusing, which is building professional visibility, strengthening credibility, and creating a more aligned and qualitative patient pipeline, especially in such fast changing times. So, we've designed today's session as a conversation, not just as a lecture. We're not here to give you gyan, but to have a two-way conversation where we together can really explore patient behaviors, expectations, and simple yet ethical ways you can enhance your presence without compromising your dignity, time, or value. The aim is to offer clear takeaways and actionables that you can implement immediately, depending on where your practice and what your practice needs. I'm very, very happy to introduce today's expert. We're joined by Mr. Gagan Kapoor. Thank you, Gagan, for being here and sparing time for us. Gagan is a marketing consultant, corporate trainer, keynote speaker, and a serial entrepreneur with over 25 years of marketing experience and 12 years in corporate training. As a founder of Go for Growth Consulting, an advisory firm, he helps mid-sized businesses achieve growth through strategic marketing and capability development. His work spans across marketing, positioning, go-to-market strategies, brand narratives, and multi-channel marketing roadmaps. Gagan's training programs delivered to corporates, trade bodies, industry associations cover leadership development, managerial excellence, sales empanelment, and marketing strategy. He has advised over 500 companies and trained 65,000 professionals, which also includes a lot of doctors across the country and medical practitioners. And he's an empaneled consultant with the United Nations. Thanks for being here today, Gagan. And I know you have something to address to our audience. But I think before really taking this off and starting this, let me just begin with this word called marketing. I know with our audience today who have joined us, it sometimes is a little uncomfortable, if I were to say, in the profession, considering all of those guidelines and how the profession is being shaped over the years. What do you think should clinicians really understand about it in today's world? Over to you, Gagan, and you can take us through what you would, want to present, and then we'll have a Q&A, and in the end, we'll definitely engage with our audience today.
All right. First of all, Sankalp, thank you so much for the invitation. I really loved the initiative, the Partners in Practice, which you have started. It really talks about how, as an organization, you think about the fraternity and really see them and how you are willing to see how you can help the professionals, the doctors, and build the healthcare. So really appreciate this initiative, and the fact that apart from uh, the marketing or visibility, you are willing to pick up multiple other topics. It feels absolutely awesome, and I am extremely delighted that I become the first one of the members or the consultants to come and present and talk about it. So before I actually present or talk about the topics which could be or which would be actually relevant for the doctor's visibility, uh, I would address the first question which you said. There are multiple restrictions, you may say, in what marketing is and how it should be done. And this is not only for the healthcare of the doctors, for lawyers, for chartered accountants. There are a set of restrictions which are there, which I completely understand. And me being into marketing for a longer time, completely relate to it. And I have had the privilege to work with the doctors in the past, helping them build their visibility. So I completely understand that it everything what we do has to be on the ethics of how we are going to really promote ourselves. There are clear restrictions on multiple things which should not be done, which I completely understand. And what I want to talk about here is that conventionally marketing, and to answer your first question, rather, conventionally marketing has been associated with self promotion, where you say I exist and you buy from me, right? And definitely this feels very unethical in a noble profession like this, and I certainly don't recommend it. Having said this, what I would like to say is that the modern marketing, not only for a profession like healthcare or a doctor, on multiple other promotions, has actually changed to multiple other factors. Modern marketing is not promotions. I would say it is more about education and communication. Right. And that is the basis which I'm going to be talking today. And not only healthcare, multiple other organizations has or have moved from too much self-oriented work to talking and thinking about how can I uh, change the life of my audience, right? What can I do better? How can I educate them better? And how can I communicate with them better? I think the modern marketing is shifting towards that. And this, I would say, should be the basis of healthcare and doctors as well. Today's patients, now if I come to specifically the topic for today, expect a lot of clarity, right? They expect a lot of trust, and they expect a lot of accessibility. They want to see things, believe things before they actually start talking to you, right? So today this whole thing, or I would say marketing, so called marketing, has moved from being self promotion to actually looking at, am I actually discoverable? Am I able to answer patients' doubts? Or am I able to create confidence for a patient even before they talk to me or enter my clinic? Right? I would say this is the level of visibility, trust, and credibility which is required. Uh, and this, I can guarantee, doesn't require to have a saying that buy from me, or I want you to do business with me. Not at all, right? All of this can be achieved, and we will be talking about it today, that how you can actually achieve it. If that answers your question, Sankalp.
Thank you so much, Gagan. I think I get your point that today's marketing is more about adding value to your prospect or to your prospective patient. Thank you so much. And I think let's go ahead with what you would want to address to our audience today. And then we'll again have some questions.
Sure. So, what I'll do is I'll take about 10 odd minutes to talk a bit about an overall structure or a plan for what doctors can actually do. I have had the privilege, I'm actually talking it from two perspectives. Number one, my experience of having worked with multiple doctors, having helped them with their business or with their practice for that matter. And the second being me as a consultant myself, right? Because I also absolutely believe that self promotion is not a great idea. And to a consultant, the only reason why people will come is when they trust and they heard good about you and they trust you, right? So I'm talking all of it from these two perspectives. So, I was actually going through some of the facts uh, uh, yesterday when we were actually thinking about this particular session. And, India has now close to 15 lakh doctors, right? And, but also the fact only some of them, many of them are working with hospitals. They have their multiple they have their practice going on simultaneously. Some of them are independently running their practice, right? But interestingly, only a fraction of them have a structured approach to the patient acquisition. And this is the first step of the challenge, what I could see, right? Uh, the clinics, by the way, now we all know that the doctors are specialists. They are they look at their profession as and it is very critically they look at their profession. They are skilled, absolutely skilled. But clinics grow not because a doctor is skilled, but because the skill is communicated and experienced well, right? So that is the second part which I would like to say. And these days, what I would say is things are moving from a profession to actually an enterprise. So if the doctors are able to see that how they can not only be consultants or professionals, but how can they actually make their profession an enterprise which is very professionally run, where hard work is not the only criteria, where thinking about expansion or thinking about how I can work smart and engage with multiple other consultants, expand my work business, that is what is critical for anyone to look at. So I will be talking about that, right? The idea is that we can bring a purpose to whatever we are doing, which needs to be communicated well, and we can have yet whatever we are doing in terms of the clinic, bring excellence to that, right? And patient experience has to be absolutely wonderful. So these are some of the critical factors in the overall marketing, I would say, right? So I would like to talk about that there is a difference between a consultant mindset and an entrepreneurial mindset, right? Very clear and distinct ways with which you can define that. Now, conventionally, we've been also thinking and that patients will hear about me and they will come to me from others. And well, this happens, by the way, right? Uh, Now, what has happened is, as a result, I've seen for a lot of doctors, because of tremendous amount of visibility, doctors have started keeping, clinics have started keeping on multiple ways. I'm going to be talking about them. What has happened is that the if people are not doing anything and the doctors are just waiting for the patients to come, there is a slight downtrend in the number of patients, fresh patients walk in, because they're already influenced by multiple other factors, multiple other doctors who are doing some things for the visibility, right? So from this traditional mindset of waiting for the patient through referrals to come, right, we need to see how can we change it to an entrepreneurial mindset where we are saying, how can I build active visibility? That's the first step. And then uh, there's a saying that whether you are in the practice or in the business or on the business, right? So many of us, and this holds true not only for doctors but also for a lot of entrepreneurs, and why they are not able to scale up is because they are totally in the business, hard work rather than smart work. So we have to see how, even if it is your practice, how you can be on the business and think strategically, and how do you really grow your practice, right? And if you want to, and now a lot of times we are also looking at that, uh, I'm looking at what is the outcome of my clinic, as in with hard work, what is the number of, can I increase the number of consultations? Can I increase my cost? So these are the usual outcomes, right? And people only think about these outcomes. While what is critical is, or what is needed these days is, how do I focus on patient experience? That's number one. Expansion through multiple consultants, or growth. A lot of times, this element also gets missed out, which becomes a challenge. Right? And what happens is that we end up relying on reputation alone, right? But we fail to build systems and processes which are actually, or which actually help you make become scalable. So if the right amount of kind of SOPs, right amount of systems, right amount of tools are brought in, it makes you scalable rather than manually doing a lot of things. And I'm going to be talking about them when I talk in my next section, right? So what has happened is, another element which I want to talk about is that a professional or a consultative mindset is at times is a lot of reactive, is not reactive. While what is needed is that I have to think how my customers are going to come 3 months from now, 6 months from now, what will keep building it, rather than thinking, okay, my patient flow has gone down, now I need to take action on it, right? So you have to become proactive with regards to your visibility, so that there is enough. And as we say, marketing is not microwavable. So you think that I can now, suddenly my visibility has gone down and I'm going to do something and the magic wand will come and now I'm suddenly visible. Doesn't happen like this. It takes at times uh, days, months, and years in building a good visibility. And especially the profession where you cannot actively market yourself, where you cannot run ads, etc. Even more important that these breadcrumbs are left in multiple ways, whether it is digital, whether it is offline, whether it is SEO, and multiple other factors which actually help you build this thing, right? So, these are some of the critical elements which we need to all take care, right? And if I were to talk about 15 years ago, generally what was okay was just having clinic locations, referrals, and reputation. The good reputation, they were enough. Today it has changed. It has moved to things like Google, Practo, YouTube, WhatsApp, Instagram, right? And of course, the number of reviews which you hold on Google, for that matter, makes a huge amount of difference, right? This has become critical. Now, marketing, by the way, as I was earlier telling, is not only is advertising. Today, marketing has moved from traditional advertising to education, educating patients, building trust, and discoverable, as I earlier said, right? And another thing which I want to talk about is doctors' biggest barrier. Now, doctors' biggest barrier is due to the hard work. There is no time what doctors have. They said, you know what, I start early in the morning, I will have some uh, patients come in, then I go for some surgeries, then I come back, and then I have patients. And by the time I get free, it's already 10 p.m. in the night. I'm totally exhausted and I can't do anything, right? Let me tell you, you do not need time. You need systems which are delegated, automated, and are measurable. If you are able to bring these three elements into your work, I can tell you, you will still be able to do what you love doing, which is working with patients, doing surgeries, etc. But will also be able to scale up. What I want to talk today is how can you actually scale up, right? And that is what needs to be done. So I will now shift gears and talk about what marketing channels really work for doctors. And since there are limited number of channels which we can talk about, and as I say, I would always talk about that no unethical ways of promoting real-time advertisements, etc., are absolutely not recommended. Neither you should try it from any perspectives for that matter. Anyways, most of the digital channels straight away will block you or disapprove your ads if you try any such means, and I do not recommend them at all, right? So let's talk about the three layers of your marketing and how can you bring this visibility. Okay, what marketing channels work for you? The first layer, which is the most basic layer, if you're not doing anything, if you are able to do these things as the first layer, which I would consider as mandatory foundations, it will do good for you. Okay, it will at least get you going. Now, in the base layer, the foundational layer, which I would say is number one being Google Business Profile, right? This particular thing is 100% priority for any doctor. That is what I would highly recommend, right? And what you need to do is you have to have, as a part of the Google Business Profile, you have to have local SEO, multiple FAQs are to be put. You need to put regular updates. You need to update photos of your clinic or multiple other education based videos, etc. Up to 30 seconds you put. Of course, be very critical that you should not put any patient photographs, etc. These are certainly which are not recommended and not allowed to, right? Patient testimonials as times also are at times not recommended. If you want to do that, their face has to be covered, etc. There are multiple regulations around that as well, which you need to take care of that, right? And then that is, so Google Business Profile is an absolute must. That's number one. Number two is you must actively work on reviews and patient feedback system, right? Which practically means Google is very clear that if a business or if a profession is reviewed well, we are going to show them right on top, right? So you need to see that actively you are taking reviews from people, which means that after every visit, an automated SMS or a WhatsApp link or a review link can be sent to them. They usually fill. It also has a limited rate, to be very honest. The best thing which I've seen many doctors now do is on their payment counter itself, they have a very nice placard there with a QR code. Simply tell your attendant to just say it, sir, it will take 5 seconds, just quickly review us. It will really do good for all the others. If you have enjoyed our service or it has helped you, others should also know about it. A simple gesture like this has increased the review rate tremendously, so to say, right? So think smaller things which will help you activate this review. Otherwise, once you send a WhatsApp or an SMS, the rate of people really reviewing is actually fairly less. So you can do certain things like this. And the third element, so first one being Google Business Profile, the second one being reviews and patient feedback, and the third one being a basic website and a landing page is also a must for you, where your services, your credentials, your awards, your testimonials, or at times people are also booking links these days through multiple such channels. Even Google has also started adding the booking link, which you can actually integrate with your calendar, and it can be put it onto your website nowadays, right? Earlier there used to be links like Calendly, etc., which were there. So this is the second part. So three elements of Google My Business, reviews, and basic website and a landing page is the base layer or foundation layer. If you're not doing anything, this must absolutely be done, right? I'm going to go to the next level now, the next layer, which is actually what I call it as the growth layer, where you can actually expand your patient flow. Here, you need to look at number one being content creation is a critical element. And this is where creation from the perspective of education becomes important. So you could create some YouTube videos, some videos which can be posted on YouTube as well as Instagram and Facebook, purely awareness based, education based. YouTube shorts are doing really well these days, which go really well. And as long as Instagram reels, pure education, talk about certain topics which are important for people to understand, they find value in it, they will start appreciating it, right? Number two, depending upon where you are and which city you are, things like Practo, the apps like Practo and Liberate are absolute must. You can definitely build visibility. People at times feel that this is a costly affair, but let me tell you, eventually I've seen this working brilliantly for the visibility as well. It closely now integrates with your Google My Business and picks up the details, and so it can actually help you do that. And as I said, the third element being, while I've spoken about Google My Business, local SEO on your Google My Business is also an advanced version which can really help you do things. Of course, you will need to use jurisdiction based keyword ranking, right? This is very critical. Whatever is allowed, you're only going to help get ranked onto those elements. So this is the second layer, which means where you start talking, building content, etc., and be on other platform as such, right? The third layer, which I would say now you move from this till these two layers were digital layers, which means You practically do not have to do beyond some time, limited time. But then the third layer can be a community layer. Now this is actually a low cost layer but high trust, which practically means doing corporate camps, right? At times you can plan society talks, or RWAs, they can organize certain camps. Be active in talking about that. It builds trust and visibility among those people, right? And of course, engagement with other specialists for cross referrals also works brilliantly for the doctors. This has been a channel for them for a longer time. So this actually helps you build a community layer. So what I mean to say is, just do not restrict yourself to the online or digital side of it. Also look at the offline ways of engaging. It's a low cost way and builds tons of credibility. Digitally, you may still have a challenge with the visibility, as in if somebody has seen your post, how well they will be able to engage you. But offline, when you meet, when you have 15 people in front of you, you are giving a talk, it builds a huge impact. The level of connection is amazing. So try and do that. Now doctors might say, you know what, I can do three other consultations at that time. Well, this is a trade-off you have to make for a long-term approach, and that is what I'm requesting you to look at, right? So this is the second layer overall, second thing overall, Sankalp, where the three-layer framework brilliantly works. The first one being the mandatory foundations, the second one being the expansion of the patient flow, the content creation, etc., and the third one being going offline in a community layer, right? Now, what I can give you as a closing thought is some of the tools which the doctors can use, right? And this is where I would say that AI, everybody is now talking about AI, listening to AI. You must also keep your eyes and ears open onto this one. This has actually become very relevant for you because a lot of tasks, by the way, can actually be taken care by AI. Chat GPT anyways is becoming very critical, right, for all of us. So website content, some of the captions, patient education posts, etc., are very interestingly being built up by AI. Of course, you'll have to add the right kind of prompts to get the right kind of results. The very recent, by the way, Instagram has launched an app called Edits by Instagram. Fabulous app. It can actually, you can generate a content from Chat GPT, put it as a prompt in Instagram edits, and then it has a teleprompter. Within a minute, you can actually create a fabulous reel which generates auto captions, and it can post it straight away, or you can download it and upload it on YouTube. I have started using it as a consultant, and it takes me hardly 5 minutes to create a post, right from shooting it to captions to posting it. And doctors need things like these, so you'll start looking at these elements, right? Some of the other tools like Canva, we've all been seeing, it is very easy to do that. I'm going to give you another interesting tool called Heygen. Now Heygen is what we call it as the it is a tool for avatars. So where you actually post some of your videos, and it actually creates your own avatar, and when you post or give them a prompt or a script, it automatically picks up some of your own environments, your clinic environment, your home environment, etc., which and create some amazing avatars. It has become now very sophisticated. I have been using that as well at times, and this again gives you scalability because you can actually create an avatar and create a video for 100 of your patients by name, like dear Sankalp, dear Nikunj, dear this, and a video goes from you, that personalized videos where you haven't even appeared, haven't done anything. So these kind of things can actually give you a lot of personalization as well, and scalability as well, right? And I, however, would only give you a word of caution that Chat GPT or an AI, at times, if you do too much of this kind of a content exactly copy pasted, it really doesn't help you in the overall SEO. So you need to be very careful that you humanize the content, apply your thoughts, give your ideas before really getting the output, right? So this will help you get there. And I would also recommend that you need to do certain things for patient engagement and some of the CRM tools as well. So WhatsApp APIs are, or WhatsApp tools like Wati or AI Sensei or Interact are good tools which can actually get integrated, by the way, through your ERPs and CRMs as well, which can start sending out. So it could be an appointment reminder or a no-show follow-up or a feedback automation or health tips broadcast, right? All of this can be automated. You don't have to worry about it. So imagine creating something from Instagram edits and then straight away going it to a patient can actually be done without you being getting involved into it once the system is set. But you will have to spend a little time in setting it up, right? That's important. Email automation for people who are interested in emails is also possible, and simple CRMs. I'm sure there are multiple clinical CRMs which are there, doctor healthcare CRMs I'm aware of. You must also be using few. Can be integrated with these ones so that the communication can happen. Nurturing is also critical. And not only that, the last element is, while you are doing all of this, tracking is also very critical. How you are doing. So Google Analytics is a good thing to have. Definitely, you must know how to really read numbers and your SEO numbers as well as GMB numbers through analytics. A number of calls which you are receiving, call tracking is also critical, so that many of your team members may end up missing certain calls which you should know, and any leads which are coming to you, you should have a CRM to dedicated to that to do that. So this is the third part of it. How and what tools can you actively use in this, right? All in all, what I want to say is that uh, if you really want a consistent patient flow, you cannot depend only on reputation. You need visibility, and uh, and for us, it is not about active advertising. It is about creating credibility, education, and visibility is what I will do. And small systems can actually help you create big practices, but done consistently. If you are able to create it small, automate it, measure it regularly, improve it in whatever little time you get for this marketing, I can still guarantee you consistency will anyway win over the quantity of effort you are going to put, right? So this is what I have, Sankalp, in this whole process.
Thank you so much, Gagan. I think a lot of insights and a lot of actionables can be drawn. Um, I was just reflecting on what you said, and one thing you said was about being proactive and not reactive.
Yeah.
And you touched base upon one limitation that every clinician or practitioner has is of time.
Hmm.
What are your thoughts? And I know a lot of the clinicians think कि मेरे पास इन सब का टाइम नहीं है,
Hmm.
पेशेंट्स आ रहे हैं और अपने आप. आई थिंक दैट इज व्हाट द कन्वेंशनल प्रोसेस mindset really is.
Yes.
Say if I were to give 30 minutes in every week, I'm sure everyone can spare that much. Do you think
Yes.
something can be done? And in your opinion, what can be those priorities that a clinician can do?
All right. So if a clinician has just 30 minutes in a week, and that is not a very big ask, I might say, right? They can do just a couple of things from some of the tools which I have just now said, right? Uh, for example, uh, once a week, just update a simple post on your Google My Business profile. That's the first thing which you should do. Definitely keep it active. If there are any reviews which are coming in, actively answer those reviews. Some of you can actually yourself put out a reply to it. It feels really personal for the patients to do that. And if possible, as I said, these days shooting a video or an educational tip doesn't take more than 5 minutes. You do not require any external help for that matter. It can actually really, really help you build that. So post regularly, post on Google My Business, answer reviews, as well as create an educational tip which is not more than a minute long. Absolutely okay. If they can do just these three things, they will build not only credibility but also visibility on the forums, multiple forums. And let me tell you, when credibility and visibility join together, they become profitability. As simple as that.
Right, right. So I do interact with a lot of clinicians, and I do sense and have had in my conversations that why do even I need something like this? Because day and night I already have a lot of patients. I don't want more.
Mhm.
I I do not have time for this, and eventually, I am also not looking for patients. Do you think uh, really that is necessary? Because I know for a fact a lot of doctors do not even have a Google profile because, frankly, they do not have time because they're full of uh,
Hmm.
patients.
Hmm. All right. So
What's your take on this?
okay. So what you just mentioned, I suddenly recall something my mentor told me when I was starting my business about 15 years ago. All right, and he said that Gagan, in this world, there is nothing called as stationary, right? Uh, when water remains stationary for a while, it starts stinking, right? So it said, if you are not going up, you are going down. As simple as that. Because others will or are making effort to go ahead or to go up. So even if you are not doing anything, you're automatically a two-step behind others, right? So what I would like to say is that visibility, whatever said and done, is absolutely critical in today's world, has always been rather, right? But because there are so many more channels where people have started becoming visible, it is critical that you are visible. And let me tell you, visibility also builds or protects your reputation, so to say, right? If you say I want to be credible, more and more people need to talk that you are credible, right? As simple as that. So that is the reason why it will help you build your reputation or protect your reputation. And what I would say is why visibility is required, because it will help you attract better and informed patients. These days, what happens is the patient walks in, they've already seen you, checked about you, seen your reviews, tested. And let me tell you, if a patient doesn't find enough information about you, and anyways, any patient is evaluating 3, 4, 5 doctors in the area, right? Traveling is not a concern if a doctor is credible, right? Anyways, they are evaluating, and if they do not find enough information and they find relevant and good reviews and information about other doctors, automatically, though the doctors who have a better visibility and reviews get shortlisted and you do not, right? So what happens is that even if you say that I was good, because there's no one to tell, right? It doesn't help you that ways. So visibility in today's world has become absolutely critical to maintain your reputation. If you have, and I'm sure you do, it requires to be spoken.
Right, great point, Gagan. I think it makes sense, and that is how things are in today's ecosystem. Typically, anyone who's making a decision, at least not very aware of the space, would go to Google and search across and look at options and maybe make decisions influenced on the presence that you have online or offline. Um, I think one more thing that I would want to touch upon, which you also said just now, is that the patient's experience begins, much before they even step into the clinic. We talked about those digital touch points where a prospective patient is looking at your social profiles, on your online profiles, and make a perception even before they are entering into your clinic. The fact is that in fact, when they enter into your room or a practitioner's room, they see, feel, hear a lot of things across different touch points. I often find that this is not that prioritized even today in our medical practice. What is your take in today's modern era? How important is this early stage experiences and all of those touch points, and what impact does it have on patients' trust and the eventual outcomes?
Very good question, Sankalp, because this has a huge impact on the overall conversion for a patient from first thinking about you to actually turning up and taking an advice or taking a consultation from you. Uh, and uh, Patients, to be very honest, today judge you from the moment they see your profile. As I was telling you earlier, that the kind of visibility you have, they will start judging you there and then, right? Your website presence, if you have sent out a WhatsApp message, or what kind of a call, or what the way a receptionist talks to you or sets an appointment with you, for that matter, or how patiently the receptionist is talking, or whatever are these factors, the way that level of interactions happen, and frankly the patient isn't even hasn't met the doctor yet. All these touch points, right from the touch points which are not human, right, which is the digital touch points, as well as the human touch point, which is your team interacting, contribute to the overall patient experience. That's the pre-interaction experience I'm talking about. They are absolutely must to be monitored, I would say. People think that just being normal is okay. Unfortunately, I would like to tell that a lot of doctors are putting in a lot of effort these days to give a wonderful experience to their patients, right from even them filling a form on their website, or sending out a message to an immediate reply which they may get, or the time duration between filling a form or sending an inquiry to a receptionist calling them, or the courtesy with which they are calling them, or the follow up messages they send, or the convenience of booking system. Many of these factors build the overall patient experience. So even if your patient experience is great, the whole thing happens is whether, so let's say the patient is in need, they will turn up eventually because they are in a dire need. At times they come in because they are in a situation like this, right? My question to you is, will the patient turn up again, is where the experience comes into picture. So the retention happens with a great experience, which is a doctor's responsibility to plan. So now I come to the post interaction experience, which practically means the way the doctor has engaged and interacted matters. But after that, what has been the follow up, whether you bother to take care of me or send me a message, whether you're still okay, or how the prescription has been sent, or checking after a few days whether you are doing okay because you came for this particular medicine or disease, for that matter, and are you doing okay, if you need a follow up. Now all of this at times can be monitored or done by a receptionist, which doesn't take that kind of a time, but just requires a system which can actually help you, that okay, a receptionist may have just 20 calls to make to just say, sir, you came in, are you doing okay, because you were in a lot of trouble and pain that day, right? A simple gesture like this can go a long way in feeling that the patient feels personal, that what, somebody cared about me. It was just not about one consultation, but somebody just cared that you thought about me. Or a simple WhatsApp message which can be automated, for that matter. You do not even have to trigger that message because it can be automated. Many of these things, Sankalp, pre consultation and post consultation, which becomes an overall patient experience, has become absolutely critical for doctors to engage with. And this is, I would say, marketing. That's what is real marketing, I would say.
Thanks again for throwing light on this. I still remember a conversation with my friend where everything was really good treatment, interaction with the clinician. But he said that I'll not visit again. And I asked why, because there were long waiting times. And second, the ecosystem or the clinic where he was sitting was not something that which made the person really very comfortable. So I mean, those are really factors today, because we've really evolved from era where we were, say, 15 to 20 years back, and
Hmm.
the expectations also have evolved with our patients.
True.
uh, we're almost at the end, and I would also want any questions, if any of our audience has, can they can post it on the chat box, and we'll be very happy to take this up. um, I think till the time, if someone has question, I would just want you, because a lot of things are in the mindset. There is a conventional mindset that has been going on, and when we talk about these newer practices, we have already seen some new age doctors really adopting those. But there, I suppose that there can be some mindset shift that even older clinicians would have to do. What do you think is one mindset shift that clinicians should take away from today's session, be it about visibility or patient's trust or offline experience? Um, what is it that you would want the audience to leave with?
So, Sankalp, what I would say is that patients trust what they see, what they understand, and what they relate to. Not just these days, not just what they are told. Even if they are told and given a good referral, I would still go online and check about that particular doctor, that particular clinician, right? Uh, what I would say is this relation, or as I said, that they are finding the ways to relate to you, right? So give them a reason they can relate to you, and that will only come if you have the right amount of visibility and you are seen on this. So what the mindset shift, what I would say, and I've been very vocal throughout the session so far, is gone are the days that you wait and say that, okay, my reputation will bring the patients to me automatically, right? There is nothing automatic these days. Yes, there will be a flow. Referrals are always there, and there is a consistent flow. I'm pretty sure about it. But that is not enough for you to scale up, right? You need to start activating these challenge channels to really get you more patients, which is patient acquisition, which should not only be from referrals. And that is the mindset shift I would highly recommend that all clinicians must do.
Right, right. So we do have a question. And the question is that, so in healthcare, trust is the factor that works. How a clinician can work to increase the trust among community or patients?
Uh, all right. So I think we've kind of answered this question already, but I can reiterate this particular point. As I said, generally there are two ways we can build this trust. Number one, which I said as digitally, uh, reviews, as I said, are absolutely critical. But talking about multiple aspects and multiple factors about the multiple factors, the diseases, or some of the things which can help people improve their lifestyle. When you talk about this, of course, you are going to be talking about your area of specialty. It can actually help you build a lot of trust. This definitely works. And the second thing, something what is being said about the community, as I said, take out time and actively do these camps, these talks along with RWAs, along with other in the societies, or corporate camps for that matter, right? Give a 30-minute, 45-minute talk on multiple aspects of your health and your area, right? It can actually help you build a lot of trust. And this is not at all selling for that matter. You're not even soliciting business here. And I completely understand you should not. But Giving a talk gives you your own set of credibility and visibility.
Right, right, right. Thanks, Gagan, for this. We have just a little more time, and I'll just sneak in one more question. You mentioned about how can you be on the practice and not in the practice, and we were discussing it the other day that a lot of other professions we see that for example, in lawyers, in architects, there are firms that are being constituted where they're working together in a structured way. We rarely see such things. We do see, but rarely see that in doctor's profession. What
Yeah.
is your take on this, and how can we be more structured? You also talked about being more structured. What is your take on how doctor can be more structured in their practice?
Great. Good question, Sankalp. So, while I've already spoken about some of the structures, digital elements which they can adopt in terms of certain tools for marketing or CRM, or in fact a calling software which can help them call track calls, etc., which gives you scalability. But I would also say that the second level of scalability comes in when you are able to create an environment where uh, you are not only running your own consulting practice, but actually expanding it to create an infrastructure where multiple other healthcare professionals can actually be there. So, which means, like the way, like you gave an example of lawyers, or for example, a lot of CA companies, they build in partners after partners to actually expand their practice, right? This is seen less in healthcare. I would highly recommend that you learn more about how can some of the things can be delegated. Create start with creating a junior teams where you there are some things, there are always the patients which require more care or more more care, or there are some of them which require slightly less attention, so to say. But having a team like this, so I would say the critical element here is, are you investing in building a team for yourself, not only the functional team which is the peripheral team of working receptionists, attendants, etc., but also a team of clinicians, right? uh, and be willing to lead them. What will happen is, if you're able to build a team of clinicians under you, this will actually give you scalability with the number of patients you can attend to, the kind of inquiries you can bring in, the kind of patient requests you can bring in. And along with that, if slowly and slowly, first you do it in your own specialty, and slowly if you can expand it to the second level, which is specialty, immediate connected specialty, if you can bring in, it actually helps you expand. And in that case, you can either bring in your own team of clinicians, or you can tie up with other doctors to sit at your clinic in certain times, for certain times, and then eventually try and have, if your practice further grows, have proper, even bigger doctors be with you. This is the practice which you can build in fact. I've spent a time, in fact, over the past few years, couple of years, I've been working with a gynecologist who was running only a gynecologist practice, as a consultant would do, to now uh, having expanded her clinic to host at any point of time 15 doctors in a span of 2 years. Now, in a week, 15 doctors sit at the clinic, and what has happened is, it has started giving her footfalls, and when footfalls come in, one doctor to the other, the referrals are flowing in, and other services has also been implemented and brought in, right? It is now on the verge of literally becoming a hospital, from a simple gynecological practice, 2 years back. So you all, what is needed is to have a mindset that, you know what, I can do things, right? And don't worry about, if you keep your systems and processes right, you can keep your legal contracts right, you will be able to expand. And this is also, Sankalp, you had added about a mindset shift. I would like to add to it that this is also a mindset shift which is required, that I am willing to expand, I am willing to let go some part of the business to be able to look at the big picture. If you keep that as an open mind, I can definitely comment. I've seen it myself happening in front of me. You will be able to expand.
Wow, that's really very valid point and interesting one. And I think we may need a altogether separate webinar
Mhm.
to discuss on this. But really well well noted and really interesting. Um, there's one more question, and I think it's a very relevant question where Mr. Ravi says that he's doing all of these things digitally, and he's not receiving the results, and how does he motivate himself? The fact is, I've also interacted with a lot of doctors where they say that for 3 months they've uploaded their content, they've done Instagram, and they've still not seen any results. um, what's your take? You mentioned about consistency, but maybe we can have some elaboration on that.
All right. I would again reiterate that line which I said, that marketing is not microwavable, right? 3 months in a marketing journey, I would say, is very, very less. It takes sometimes months and years to really build your presence if you are doing it consistently. So first element is the consistency of the approach, and do not think that it is not working, and do not be impatient with it. That's the first element what you need to look at. And second thing what you need to look at is the quality of the content. If I may just give another nugget of advice, specifically when Ravi actually said, I would say you look at three elements, okay, in marketing. That the first one is that what you need to look at is, you need to look at whether your message is right. That's the first element. Are you passing the right kind of message to the people? That's the first thing. The second thing is your medium right? Are you reaching out to people through the right channels, where they are present, and they should hear from you, right? That's the second element. So message is important, the medium is also important, right? So if these two elements, I would say, are met with properly and dealt with properly, there is a high chance that your uh, uh, message passes across. And another thing which I would like to talk about is, what is your market? The third M, which is actually the audience, right? If your audience choice is not correct, or your message is going to the wrong audience, right, you are not going to get a response. So three M's, or rather three elements: the way you project your message or present your message is one critical factor. That's when marketing doesn't work, if the message is not right. If your medium of reaching out to them is not correct, marketing will not work. And if your audience is not correct to whom you are reaching out, the marketing will not work. Any one of them is not right, your marketing will not work. So for your marketing to really give you results consistently, your message, your medium, and your audience, all three have to fall in line together, right? And that is when your marketing delivers results to you. So maybe for Ravi, it could be that any of the elements, either the kind of message you are projecting, or the way you are reaching out to them, or where you are reaching out to them, or to whom you are reaching out to them, may have a challenge. You may want to address it, and it will probably help you be better or start getting you results.
Right. And in my experience as well, it takes time to strike chord with your prospects. It's a continuous learning where you do a lot of these trial and errors, and eventually uh, become successful. But I think one critical word that you mentioned and is very important is consistency in marketing, and eventually you will get the output. Uh, I think that is we what we had our time today. Thank you so much, Gagan, for your valuable insights, and Thank you to everyone who has joined in. I hope today's session gave you some practical takeaways that we promised and new perspectives that you can apply as you continue to grow and shape your practice. We look forward to staying connected and building this journey further through Partner in Practice program. Wish you a very great evening and a great weekend.
Thank you so much, Sankalp, for your invitation. I absolutely loved the interaction, and I must reiterate that the initiative which you have started, which Dr. Bilal Labs has started, is absolutely fabulous. And I'm sure, and I can see some of the doctors in fact, many doctors in the attendees. I am absolutely sure that this kind of initiative is a must for the doctors to upskill themselves in many areas of their practice. So, congratulations to you for starting it. And I'm absolutely glad and honored to be a part of the first episode. Thank you so much.
Thank you. Thank you so much, Gagan, and thank you everyone. Have a great day.
All
Thank you.
right. Bye bye. Bye bye, everyone.